Hi everybody, Heather here. So I thought I would make a video on exactly what happens when you have a colposcopy with a biopsy while pregnant. I've gotten a few messages from you guys asking if it was painful and what exactly happened. So instead of answering all of them, I thought I would just do a video because even before I had the procedure done, I looked all over YouTube and the internet, and there wasn't really a lot of videos or information or anything like that that I could find that was very helpful. So I will start. I am 6 months pregnant, and what they do is it's when your pap comes back abnormal. Obviously, if you're watching this, your pap has already come back abnormal and they want you to do this. First off, being pregnant and having this procedure done is scary. There are risks, and the doctor went over all of the risk before she did the procedure. She actually called me and told me, and then she went over everything again once we got into the room. So you go in, and if your doctor is like mine, she'll go over all the risk, which is infection, preterm labor, miscarriage. Those are just a few of the big ones. And then she will go over what the outcome could be, like what she could find, what she's looking for. And basically they're looking for, they're most likely doing the biopsy to see if you have cancer or not. So that's what they're doing. So anyway, they have you put on a little gown thing. She didn't ask me to take off my top. I just had to take off my pants and underwear, and you can leave your socks on. And it's pretty much just like a pap smear, except longer and more uncomfortable. The first thing she does is she put in the, I can't ever remember what the name of that thing is that they use to open you up. So she put in those, and to get a good look, and then she put in the scope and looked around, and then they put in like this solution stuff, I guess, to kind of like clean it, and then they put in, which is fine, and then they put in like this acidy stuff, and that is actually, it's supposed to, like, I've heard other women say that, like, it really, really burnt them, like it burned, but I really didn't get a burning sensation from it. She asked me if it was burning, but it wasn't really. I really couldn't feel the burning sensation. But they put that on there, and then what it's supposed to do is when they flip the light on their microscope, it's supposed to, like, I guess, turn a different color so they can see what cells are abnormal and what cells are normal. And then once they do that, then they take a biopsy from whatever patch that they see. And that was a little bit uncomfortable as well. I wouldn't say, I mean, it's not pleasant. I'm not going to lie to you. It's not something that you're like, oh, whatever. It's not pleasant, but it's not as bad as I thought it was going to be. Like, it was okay. And my biggest thing, I said in my other video, my biggest thing was she was having a hard time seeing because my cervix were so high up, so she kept having to, like, readjust things and readjust her tools and her camera and everything. So that was, like, my biggest issue. And then that's pretty much it. Like, after she does the biopsy, oh, this is like the worst part. Actually, I was going to totally skip it too, pregnancy brain. Once she's got the biopsy, you'll bleed a little bit. So what they do is they have like this brown pasty gunk stuff, and they put it all over your cervix to, I guess, to try to stop the bleeding. And she put in so much of that stuff on me. Like she kept, I was watching her, she would like tell the nurse like, can I have another swab? Can I have another swab? And I would see the nurse like get a big like clump of it, and like she would give it to her. So she put a lot of that stuff in me. And I will tell you, like, there's iron in that stuff, so you will have a discharge. I don't know how long this discharge lasts. It's been like 4 or 5 days for me so far. But you will have a discharge, and when you have it, it smells like iron. It smells like metallic-y. It smells bad. Also, too, hopefully it's just women watching this because this is totally like TMI. But your discharge will be, you will have that brown stuff, that paste that they put in. So I guess don't be nervous if that happens unless you're like in an extreme amount of pain and having some crazy discharge. You will have some cramping. I was sore. I was fine after we did it, really. It was the next day. I woke up pretty sore. And that eventually goes away. So anyway, that's what I wanted to share with you guys that were asking. Like I said, it is different. I've had abnormal pap smears before, but it's just different when you're pregnant and they're wanting to do biopsy to see if you have cancer. It's just, it's scary, it really is. And it's not that I've never heard of it before or anything like that. Actually, I've met a lot of women that have had this procedure done and everything came back okay, and I've heard a lot of good stories. But I haven't met anyone pregnant yet. So anyway, that's this video. And I hope if you are pregnant and you're having this done, that everything turns out okay. And don't be scared of it. Obviously, if you're pregnant and they're wanting to go ahead and do this test, it is necessary. I myself tried to delay it until I had the baby, and I really tried to talk my OB office into letting me delay it, and they would not. Well, ultimately it was my decision, but they really didn't think it was a good idea to delay it. So they actually said that the risk, the benefits of having the test done outweigh the risk of miscarriage or having to deliver early. So when they said that, I knew that they were serious. So I don't think any doctor wants to take a baby at 26 weeks. So it needed to be done. So anyway, I hope this video helps somebody. And that's it. If you have any more questions, just leave them for me. I'm sure I forgot something. I have pregnancy brain right now. I'm trying to get through this video before Maddie wakes up from his nap. And so that's it. I'm sure I'll think of something else. But anyway, everyone have a good day. And hopefully I will have a good news video next week. I think my appointment is on the 24th, but I'm hoping, let me see, I'm really hoping that they will call me and let me know, as soon as the results come in, they won't keep me waiting. So, anyway, so that's my video. Everyone have a great day. Bye.